almost every joint in the human body is predisposed to arthritis. Are we as Indians or South Asians more prone to get this kind of a problem?
Yes.
It seems through all the epidemiological studies that have come through that we are actually much more predisposed than the Western sort of population. We are actually seeing arthritis, the radiological features come on about 10 years before they're coming on in the Western population.
In other populations. So if it's 50 or 60 in the other populations, 10 years, a decade before.
A decade before.
Ever had an ankle injury, a fall, broken a tendon, or stretched a ligament? Have you ever sat in chronic pain for several days or weeks? What have you done then? Have you gone to your doctor, to your physiotherapist, maybe to an acupuncturist, or maybe you took suggestions from your yoga instructor? Let's take a deep dive into what you need to do when you're struggling with bone and joint issues. Hi, I'm Dr. Archana Nayar, and you are watching and listening to The Thoughtful Medic, your space for meaningful, candid conversations with doctors and experts in the field of medicine. Our guest today is an orthopedic surgeon with more than 30 years of experience in the field of orthopedics. He is currently working at Fortis Hospitals for the last 16 years. He is the principal director, and a very, very warm welcome to Dr. Gurinder Bedi. Doctor, welcome to the podcast and welcome to The Thoughtful Medic.
Thank you.
Given that we are a preventive and supportive podcast, I want to focus my first few questions not on hospital procedures or conditions like fractures or dislocations, but more on what you see on a daily basis in your practice with regards to everyday conditions. So please tell us, what are the most common things that you see in your daily practice?
So, Archana, well, for a starter, thank you so much for having me on this podcast. So, it's very surprising. I work as an orthopedic surgeon. I sort of make my living as a surgeon. But, most of this practice that we have is actually people coming in more for the preventive aspects or for small injuries or something, and discussions about how to stop things from getting worse. So it's not. So the field that you're talking about is not alien to me at all. I mean, if you look at our OPDs, majority of the patients are not getting operated, irrespective of everybody saying it's a surgical field and that's what we enjoy. But it's not all surgical.
Good to know that. Yes.
So we really sort of, if you ask me, what are we doing? Most of the people we are seeing are neck, shoulder pains. That's a fairly big chunk. Knee pains, low back pains, and then we have things like some injuries which are coming in. So it's a fairly diffuse mix from almost sort of just from the base of the skull to the toes. And whole subset of things that we end up seeing every day.
And so I'm sure a lot of people listening in can identify with many of these problems.
True.
So what are the kind of conditions then that we are looking at which are preventable or modifiable? What can we do about these things? And if we can go a little bit into diagnosis, when you say shoulder pain or neck pain, what are we looking at?
Sure. So Archana, a large part of what we do is actually advising people on the preventive aspect. So we actually filled with a lot of young people as well. We almost seems to get sort of the age group of that 18 to 30, and then we get a lot of people like 60 plus as well.
And people are in the middle are healthy.
In the middle are somewhat healthy. Maybe I think they've learned how to survive in adverse conditions by this stage. So the younger people, I think, are the guys who've got a mixture of either sitting in the office for too long. These are the kids who are making their way up in the career, and they're putting in as many hours as they can, and they're stuck. Most of us, as fairly stuck to our laptops and our desktops.
Yes.
And the other thing is obviously the telephone, because the screen is even smaller, even more focusing down, looking down all the time.
And this is impacting our neck.
Absolutely right. The neck and the neck and the shoulder kind of stuff, which is so common. It's hugely common kind of stuff.
So this is digital. This is almost digitally related, these conditions.
True, pretty much. It's almost like become a way of life, I mean, who doesn't have a phone? Who's not sitting in a metro with the phone in their hands?
Yes.
Who's not sitting on the dining room with the phone in their hands
that
nowadays?
That is unfortunate.
So, I mean, this is, you walk into a dinner and, you can actually see, the son's sitting there with somebody else, and, everybody's got a phone or every few minutes looking down to see, are they missing missing out on something in
focus
life.
issue.
True.
But what do we do? Are there things that we can do to prevent this or actually modify things in our behavior and our physicality?
So one thing that has happened is I think our screens are getting very small, our devices are getting very
Yes.
small because we all like the idea of portability. So actually having a larger screen and shifting from maybe your phones to your desktops or something and having large screens sounds to me like such a great idea.
Is it? Is it?
And the other thing is work environment. They're all sort of, you can't be sitting in your bed with something on your lap, or you're sitting in a sofa kind of a stuff. Even if you can get the work environment right, at least get your alignment right, get your shoulders braced back, get your head not looking down all the time. The other thing is frequent breaks. I mean, people get too coned down with something. Even if they're not at work, they're looking for something. They could easily spend, and half an hour looking for an airline's ticket kind of stuff. So that's a huge amount of time, with that stoop down, shoulders rounding off, your head and your neck sort of away from the center of axis of your body. So that's a hell of a lot of things which can actually go wrong just sitting like this and straining your eyes all the
So
time.
body awareness when you are doing these things would go a long way.
True. So knowing what your normal resting position is, getting your body back into resting position, frequently changing your position, getting up, sitting up, stretching backward. It just doesn't take too much time. It's
Just
actually
move, just move.
Just move.
Just
So all
move.
you need to do is, all these things now you can actually put an alarm and say,
Yes.
give me a bleeper every 15 minutes, and that's all you need to
Start
do.
walking if you don't know what else to
Absolutely.
do.
The other thing is, don't depend on other people to sort of, give you everything while you're sitting down plonked up. So it's like, that child calling his mom to say, look, I want a cup of coffee kind of a stuff, or calling your maid servant or something to give you something. So get up and do it yourself. So rather than send, an email to the man sitting on the next table, would you mind getting up and, having a little chat with him? Also ask him how his family is doing at the same time.
So the personal connection
Absolutely.
also.
So deliver a piece of paper to him, ask him what's happening. All it does is make you get up.
Yeah.
And as easy as that. I would have liked to say have a cigarette at the same time, but I think I'll refrain from that.
I don't think we can say that.
I think we'll stay away from that field.
Yeah, in preventive medicine we cannot.
True.
But sorry, go ahead.
And the other category which we're seeing is, postmenopausal women. Now that's a huge chunk of my
Yes.
practice. So menopause is one of the most defining things that happens in women's life, just at the end. Well, let me call it a midlife. And
Let's
at the end
not
of
call
midlife.
it end of-
Maybe we won't. Actually, end of midlife or in the middle of midlife. Maybe more diplomatically
all
correct.
right.
So that's when a lot of things happen to women at that stage. One of them is obviously that the withdrawal of the hormones has a huge impact on them.
Yes.
Second thing, so that makes a difference on your flexibility of a joint, your bone strength going down, your muscle strength going down. It almost nosedives after that.
So this is something that it would be nice if women were prepared for it. Like a lot of us are struggling with perimenopause, menopause, and we don't know what to expect.
True,
So the
absolutely.
information would be helpful as well.
Absolutely right. And the impact it has on your health and the health risks which start off almost immediately after that is a fairly big thing that women need to sort of take it in this stride. And as you rightly said, you prepare for it. It's
Yes.
coming. You know it's coming. You know that this is the time when you really need to rev up. There is this little psychological thing which happens, if you ask me, because that's when the time when the house is getting empty. So,
Yes.
the kids are all sort of leaving. They suddenly realize they actually have that time in their mind,
Yes.
time in their hands. They're not that active. They're not cooking or looking after the kids' problems.
Work is gone. Yeah, your
Absolutely.
identity is also kind of shifting, isn't it?
Absolutely
Yeah.
right. And the man of the house is still doing what he wants to
Yes.
because he's worked until about 60, 65. So he doesn't notice it as much as
Yes.
the woman does. But
True.
for her, it's a fairly big thing. And
Especially in India.
preparing yourself is a very important thing. And a large part of that is obviously what happens henceforth in menopause.
So let's since you brought it up, menopause. What does it have? What happens in terms of bone density? And of course, you wanted to bring up other issues related to that. What's happening to bones and joints in menopause?
Okay, so we know from all the literature that has ever been printed that you reach your peak bone mass and your peak muscle mass by the age of 30 or 35. So you will not get a higher muscle mass until you start using synthetic substitutes and all. Let's not go there. So now we know that the decline will happen.
Yes.
The one thing we don't know is, well, we do know in a matter of speaking, is how rapidly the decline is. That is to say, the curve has gone up till now.
Yes.
Now we've reached that 30 kind of an age. Now the decline is whether the decline will happen precipitously or it will happen very, very slowly. Now that will depend on what you do from here on.
So 35, you can modify your behavior so that at 55, you are, there is variability in what
True,
you
but
have.
remember the first 35 years, you can make it peak higher. So that's what you need to tell all the
Young
children
girls.
in school. Peaking now is what you really need to do. If you miss out on the school days just because you're preparing for a NEET exam or a JEE exam, the body is not forgiving. You're doing it at an expense of your physical health, which will be with you for your lifetime. I do understand the degree will be with you for a lifetime, but
Yes.
this physical health will also
But
be.
so important because parents need to hear
Absolutely.
this, that girls need to be physically active. And so what you're saying is sports, physical exercise. What are you...
And, one thing that it's almost like a cultural thing in this country is, the games period happens.
Yes.
And the boys are all busy with their, footballs and crickets and everything, which is not much. Sorry, I'm not trying to make it as if, they're very athletic kind of stuff, but at least they do that.
Yes.
The girls are actually almost at least in my, I'm an old man now, we're almost, sitting on the sidelines or doing
changing now,
something very,
but
I'm
yeah,
sure.
it's
so
changing
most
now,
of the
though.
schools have like football teams and all
Yes.
that kind of stuff. So
Yes.
I'm very happy that at least there's this thing to be done. But when we were having this kind of initial practices for match at our time, obviously there
Yes,
wasn't
it was
much. But I'm
different.
sure it's a very, very changing thing. I totally agree. So build up the mass there, and once you and continue with it. Don't just physical activity is a way of life. It should be like, it should be like you having a cup of tea in the morning. You just don't have to say, oh, do I really have to do it today? It's just something you do.
It should come naturally and should be integrated into your life in a fun way, if
Absolutely.
possible.
It's
Yes.
a flow. It's a flow. It just,
Yeah.
I get up, I walk, I get up, I do my 10 Surya Namaskars every day. So it just should flow like that. Why have this kind of thing? Oh, do I need to go to a gym?
Do I
do I
need to
have to
work
do this
out?
today? It's not like that.
It's
at
not
all.
a chore.
Absolutely.
It's not a
right.
chore. It's something that you should enjoy and that your body can do these things. We should be happy about it.
True. Absolutely true.
So coming back to menopause, you are saying something very interesting. You are saying it's not about when you reach menopause. It's much before. It's many decades before.
True. So what you actually done till now is sort of build up some mass. Now we're talking about maintaining masses.
Yes.
So maintaining is actually a combination of lots of things which you need to do, which includes maintaining that flexibility of the body, the strength training and everything which you need to do.
Yes.
And you really need to maintain it constantly as much as you can. And with the age, you don't actually come down on this activity. You escalate this more and more. And remember, you've got more time now because the kids have left or the exams are over kind of stuff. You actually need to think about escalating it and say, look, if I could do 3 kilometers at a stretch, let me just push it to 3.5, 4 kind of stuff. And again, if I was doing 3 days a week, let me make it 5, 6 days
So
a
it's very
week.
important to clarify this because culturally in India, there is a myth that as you get older, you have to sort of tone down. You have to do things less. You have to work out less. You have to just do less. So, of course, there is so much research saying that you need to do more is exactly what you are saying here. That as you get older, you need to do more, not less. Maybe not in terms of intensity, but maybe in terms of consistency.
Pretty much. And you'll also have to work on the idea that now your muscle mass is really declining. So our body's stability, our body's function, our body's ability to do simple things like climbing upstairs, getting up from a sitting position, balancing when you're walking is all depending on your muscle tone and muscle strength. The more you actually work on your muscle strength, etc., which is not going to happen with that daily walk that you were thinking
Not
of
enough,
doing,
yeah.
you will struggle.
So what you are
His-
saying is weight training or weight-bearing exercises like yoga and Pilates. What are you suggesting as a doctor?
So strength training really kicks in at this stage. And one thing about strength training is you don't need elaborate gyms. You don't need massive irons and dumbbells and all lying around here. You can actually do your body weight strengthening exercise very easily, which is where things like yoga comes in. Pilates, brilliant aerobic exercises. Like a dance studio kind of thing. Love it. Just love the idea of, pushing yourself with the strength training. And remember, standing on your feet for doing this is the epitome of thing. If you're doing things sitting down, chances are not doing enough. Some people say, well, swimming is brilliant. No doubt about that. Maintains the flexibility, maintains the strength. Not good for otherwise for building bones because of the weightlessness which comes. Cycling, again, I mean, it's great if your joints are really, really bad. Great exercise.
Yes.
Not enough for building the strength of the bone. So don't give up on walking if you're doing your cycling kind of stuff. So it's a combination. Don't go with just one thing. I do my walks. I've done enough. It's not enough.
It is not enough. And that's important as we grow older. Doctor, you also mentioned that there are other lifestyle diseases that you are seeing in common. I wanted to bring up arthritis here because I know that's a common condition in India.
True. So now arthritis and actually, if you, I wonder if you remember, India Today ran a little column on arthritis, which basically talked about the idea that pain is the new this thing. It was a cover story on India Today, essentially showing that almost every joint in the human body is predisposed to arthritis.
So it is an inflammation, isn't it?
It is an inflammation. It's inflammation that will happen. So essentially, as I'm sure most of the people know, that essentially your cartilage is getting damaged when arthritis develops. So the gliding of the joints, the movement of the surfaces against each other is a problem. So now this can affect many parts of the body, as we all know. In India, we talk a lot about the knee joint, but the same kind of pathophysiology happens in the back, in the neck, in the hands, in the hips. You name it, any joint. So the weight-bearing joints are much, much more prone to have it.
Okay.
But if somebody does, so which is the commonest joint in the body, it's actually the thumb, the base of the thumb is the commonest joint in the human body to have an arthritis. Now, the question we're asking is, are we as Indians or South Asians more prone to get this kind of a problem?
Yes.
It seems through all the epidemiological studies that have come through that we are actually much more predisposed than the Western sort of population. We are actually seeing arthritis, the radiological features come on about 10 years before they're coming on in the Western population.
In other populations. So if it's 50 or 60 in the other populations, 10 years, a decade before.
Even things like osteoporosis, which is obviously completely different from arthritis. Sorry, I digress from the question that I asked you. But not arthritis and osteoporosis both coming quicker. I'm sure genetics has something to do about it. We haven't identified the gene trait, but one day some clever man is going to come up and say that's the reason why you're getting more prone to arthritis.
But we know that it is. And what can we do to reduce the burden of pain, disease, inflammation? If we are going to get it, can we get it later or can we deal with it better?
So as you rightly said, there's things like modifiable factors and non-modifiable. Well, if your genes have it, you have it. But it's not. I mean, given, people come and say, oh, my whole body is arthritic. That's a foolish attitude to take. Simply because then you've given up. Because you've decided, I have a disease, I'm going to die because of something to that effect.
Yes.
So it's now we talk about modifiable factors, thing which you can do to prevent this from affecting your life or becoming the center of your life.
And quality of life.
Somebody
listening in, they have it. Let's improve their quality of life.
The implications of arthritis are immense. So one, as you said, the quality of life. Second is your dependence on other people because, you think, look, I can't, the retired kind of people. Now we all live in nuclear families and the retired kind of people says, I'm never going to be able to survive like this because my kids don't live with me.
And how will I manage?
Then people start having falls and everything because the joints are unstable. Then you start unable to cope up with some people are still, working at, the 60, 65, 70.
Yes.
And, they say, I can't keep up with my disease. I can't climb the steps up to a metro metro train or something.
That's a huge restriction.
कितनी देर खड़े हो सकते हो तुम ये सब and हर एक जगह कुर्सी नहीं मिलने वाली. So तुम्हारी जिंदगी में फर्क तो आ ही जाता है कुछ
restriction. It's a restriction.
Restriction आ जाती है. Exactly right. अब हम देख रहे हैं कि modifiable factors में आप क्या-क्या कर सकते हैं. तो सबसे बड़ा जो I think कर सकते हैं is weight. So overweight hona is actually not a great idea. I'm not being politically correct out here, but whichever way you look at it, the body is going to work much better if you're not overweight. Second thing is activity level, जिसकी हमने अभी बात की थी.
Right.
Third is strength building, which is जिसकी हमने बात अभी कर चुके हैं. Fourth is a regular kind of almost like a like a regularity of physical therapy, not just कि मैंने चलो कल कर ली थी, परसों कर ली थी. Make it into a routine, अपनी life के अंदर routine.
Right.
Then we talk about these are the sort of simple things that you need to do. One thing, I don't know, I'm sure people have lots of conceptions about this. People keep saying कि मैंने जो स्पोर्ट्स खेला था शुरू में अपने स्कूल के दिनों में, उसके कारण ये हो रहा है. This is load of bullshit.
Some 30-year-old injury which is being remembered.
And they keep, and because they transferred that thought to their children, to their neighbors and all, कि उस वक्त स्पोर्ट्स की जो इंजरी होती है ना, अब तंग करती है. And which is very contradictory to what we are trying to tell them. People have, people only, मैंने बहुत काम किया घर में. घर में क्या खाना ही तो बनाया था, कपड़े धोए थे, प्रेस किए थे. मैं मना नहीं कर रहा कि it is an effort.
Yes.
But trying to think कि वो किया था ना, देखा इसलिए अब प्रॉब्लम हो गई. That is very, very wrong. And I really want people to walk out of this conception. And in fact, all the studies which have been done have shown कि जो लोग sedentary होते हैं, जो उनका chance of arthritis is actually the highest. उनका chance of getting arthritis is higher than that of वो जो laborers आपने देखे जो सर के ऊपर ईंटें लेके वो तीन फ्लोर चढ़ती हैं, उनके chances कम हैं.
Their bones are strong.
Absolutely. And the muscles are also stronger, and their arthritis, or chance of developing an arthritis is lower. This is statistically proven. This is not something I've invented from the wall kind of a stuff. This is what it is.
So, doctor, rest is overrated.
Rest is very overrated. Very overrated.
Rest and comfort is overrated.
Absolutely. And ये जो थकान वाले होते हैं ना, मैं तो आज बहुत थक गया. It's a state of mind. There is no human body was made to climb trees, to swing to trees, live in forests. How can you get tired sitting in a car?
Yes.
How can you get tired sitting in an office?
There is fatigue of sitting in a car, but it can actually be countered by moving. True. Instead of sitting some more.
Instead of
by sitting some more.
Absolutely right. So these are the modifiable factors. If you ask me, there is this role of diet as well. I mean, so we are actually, there was our mothers, grandmothers always talked about the idea of eating right.
Yes.
And we kept on thinking कि, the generation came and asked, खाने से क्या फर्क पड़ेगा?
Yeah.
Now we've actually gone full circle around and realized कि maybe there is something
100%,
to be.
100%, yes.
So
Nutrition.
now we talk about microbiomes in the gut.
Yes.
So we're saying कि तुम्हारे जो gut के अंदर, तुम्हारी जो intestines में जो bacteria है, that is influencing a lot of diseases.
Including bones. That's very interesting.
Including arthritis kind of stuff. Now people are actually now doing your analysis of bacteria in your stool, and this is not hearsay. This is Nature magazine, one of the most revered magazine in the scientific. Nature ran 3 cover stories on microbiomes and their effect. You will be so surprised at what now people are digging out. So don't give a short shift to the idea कि खाने से कोई फर्क नहीं पड़ता.
So when your grandmother says eat your ghee, eat your dahi, eat your fruits, eat your vegetables, sleep on time, it's all true.
Absolutely right. And I think, someday I think we'll see that vegetarian food, maybe again, this is not proven, is actually a very good thing to have.
Maybe the answer.
So that may be the answer. So we're really pushing on anti-inflammatory diet and antioxidant diet and supplements in diet, which is the new coming up kind of field.
So let's talk a little bit about supplements since you mentioned it. So for bone health, I mean, we of course know of calcium. One talks of vitamin D deficiency in our country. And there is the whole new kid on the block, collagen, which is also supposed to be very helpful. So your thoughts on all of these supplementations for bone health?
So while I might sort of talk a lot about the vegetarian food and all, I would seriously say our diet is very poor. Mainly our diet has got very, very poor because our stress on grains have actually been too much.
So we are carb heavy, which is a problem in our country.
So we are, we love our wheat so much, we love our rice so much. And I think there's very little to say. Pet zarur bhar jata hai, so I can understand a laborer
Satiety.
That is what it does. But if you ask me seriously, nutritional value bahut hi kam hai. So what are we looking at? So we know that dairy is not something that we indulge in too much in this country. We know that eggs, non-vegetarian food is looked down upon kind of stuff. So calcium, you need to find a source.
And is supplementation the answer, or do you think it should be fruits and vegetables like broccoli and things like that, and nuts which are heavy in calcium?
For me, if you ask me, post-menopausal women, take your supplements. You will not get it enough in the kind of diet we are presently eating, unless you have a complete transformation of your diet and say, okay, I'm changing everything and stuff. Men above 60, women above 50, I'm saying supplements le lo.
Does it matter if you're
Below.
vegetarian, non-vegetarian, egg eating,
I'm
non-egg
actually,
eating?
for women, I'm saying take
it no matter
because
what.
you'll be
Okay.
so surprised. I mean, we're tired of seeing women with low bone density walk in and, everybody coming around saying, मैं तो बहुत खाती हूँ. And, they've had, so you total of, the best sources, obviously dairy as we know it.
Yes.
Most of them are eating, nobody drinks milk in our country. Some people have the studies looking at lactose intolerance
Yes.
and that kind of stuff. So we're looking at two choti katoris of dahi.
Yeah.
उसमें तकरीबन मैं ख्याल मुश्किल से 150 मिलीग्राम दही होता है. तुम्हें पहुंचना है तकरीबन 1000 मिलीग्राम कैल्शियम दिन का कम से कम. अगर आप सारा टोटल करके देख लो 400, 450, 500 सब मिला के. But as you rightly said, the broccoli, the green leafy vegetables,
Yes.
the nuts and all.
I'm looking at vegetarian options.
Absolutely.
Yeah.
Eggs and all are also something that we can take. Vitamin D is a sunshine vitamin. We know it. And supplementation की जरूरत इसलिए पड़ती है because we all have shifted to the city life. The air that we live in doesn't let the rays get in. When we can get an access, it's too hot to get an access. When you want to get an access, the winter is an unfavorable time for vitamin D. So you're not winning this battle.
But we do need it. You do feel for our bone health, the way we are looking at bone density, we need vitamin D and calcium at optimum levels.
Uske bina to, and I can tell you, rampant hai. I mean, in fact, ek time tha when we were getting everybody tested with vitamin D. Now we say, why do you want to waste your time?
They're all low.
You're all deficient. The other thing that we talking about is magnesium in the diet, which you can have enough vegetarian sources, the pulses, the seeds, and all.
But everyone is supplementing on magnesium now.
Magnesium seems to be something you can actually pick from your diet. Again, I think I hate to make postmenopausal women sound like sick percentage of population, but maybe they'll be better off with some magnesium. The other thing we're talking about now is something called vitamin K2. Again, something which you can get enough from your diet. So if you look up any source on Google or something, you'll see the vitamin.
And vitamin K2 is beneficial for bones again.
Bone strength. Absolutely right. Now we have these smaller elements that we talk about. I mean, vitamin C is a good thing, mainly because it helps in collagen synthesis.
I was going to ask you about collagen. Yeah.
And collagen is what makes up, as you know, the muscles, the ligaments, and the cartilage. So vitamin C supplementation, unless again, I hate to sound as if I'm a drug peddler out here, but you can get enough vitamin C from fruits and everything.
So you do sound like you like that it should be absorbed from the natural food chain rather than supplementation.
So this has been proved again and again that your absorption is actually better if you get it. So whether it is an iron, whether it is a calcium, whether it's a vitamin C, the absorption is better if you take it through a natural source because of the binding of different things that you can actually get a better absorption. So we got calcium, we got vitamin D, we got vitamin C, we got K2, we got magnesium. There are other things like boron or something that those are micronutrients, maybe not that important at all.
But you take care of these, then you're taking care of your bones.
True.
And collagen, a lot of people are using collagen for skin, for skin health and all. But in terms of bone?
So aesthetics industry is flourishing on the use of collagen, whether it's fillers and all that stuff.
Yes.
So now collagen is the new, let me call it the new whiz kid on the block now for managing arthritis. So for years and years, we've actually been looking for something to help at least maintain the cartilage, if not cure our cartilage issues. We've done, I'm sure everybody's heard of glucosamines, chondroitins, MSM, diacerins. So none of them has actually lived up to the promise. They all seem to make sense because we realize that they were natural constituents of the cartilage. डाल दोगे तो हो सकता है कि बेहतर हो जाओगे. But किसी ने अपना strength of scientific evidence नहीं दिखा पाए.
So we don't have evidence-based.
बिल्कुल.
But you believe.
So collagen is a new thing. Remember, people want something. I'm not trying to again sort of be, let me call it, be very this thing about people, but everybody wants कि यार कुछ तो होएगा. I mean, how can you leave me like this and say
There has
there's
to
nothing
be
you can do
something.
about me? I'm going to have arthritis. I'm going to have an operation. So this is something that we would like to try. But again, scientific evidence, remember, is based on a lot of studies and research. You
Yes.
just can't. WhatsApp message banana is very simple. I can just make a WhatsApp message today and say, Dr. Bedi says collagen le lo. And but when I go to a scientific journal, Dr. Bedi cannot say na ki collagen le lo to aap theek ho jate ho.
Yes.
He says, yes, it might be helpful, but not.
Fair enough. Right.
It is available. It is very, agar lena hi hai, to the undenatured collagen type 2 is the one to take. It is available, slightly expensive as a tablet, but it is available. And yes, I do prescribe undenatured collagen type 2.
Excellent. Thank you for that. We'll move on, Doctor, to a very popular topic, which is sports injuries. Almost everyone, and I started the conversation with that, would have suffered with something. I personally have been under your treatment for an ankle injury and for my chronic back pain. And one, I want to ask you, how often do you see these kind of injuries? And what can we do, again, in our exercise or in our behaviors to reduce the burden of this?
So, it's actually, this is very funny, I'm actually very happy when I see sports injuries. Why do I feel happy? I feel happy because at least I understand that, kids are getting in there to pick up, to do sports.
Yes.
Which is good, because when you do sports, you will get
there
injured.
There will be something, yes.
Exactly. So the happiness comes from the fact, at least you made an attempt. The unhappiness comes from the mother who says, you're never going to play football again. Those kind of things. They say. And, that's not the way to look at it.
Parents get traumatized very quickly.
People get traumatized very easily. Look at you. Now I'll have to get you to the hospital every day. Now I'll have to put you a plaster. So I can understand their frustration. But please, can I just heavily suggest, do not stop that. Injuries can happen with anybody. Accidents can happen with anything. Yes, I know higher incidence in sports fields and all, but
what are we seeing? And in fact, when we see sports injuries in slightly older individuals, and this might be usually somebody who's working out, maybe not playing a sport, or playing something like tennis or something which is high impact sport.
True. So now we come to a large sub of population, which is, the slightly more seniorish people trying to sort of suddenly hit the gym and everything, or suddenly say, look, my childhood interest in tennis needs to be reignited today.
Start playing it again.
And start playing it again. So the problem with these people is, they go on that, Saturday, Sunday, weekend kind of a stuff. I think the Americans call them as the weekend warriors. They just step out and, they start whacking the ball around. And that's a little problem because, they've been pretty much couch potatoes for a very, very long time. And I understand sports is so much more enjoyable than exercising.
Yes.
Mainly because it's a group activity. Yeah. So, you have this person at the other end you're fighting a duel with, and, you're shouting, abusing him and he's abusing you. Those kind, it's that camaraderie which develops.
Yeah, it's a social
thing. So people like that idea of thing. But the problem with that is a tendon which is not stretched for a very long, a ligament which has become so brittle because it's been so stiffened out. Suddenly he has to work overtime and, go and do this kind of thing. That's the one who come back with a lot with the injuries. The gym-based injuries, especially the resistance exercise with weights, is another thing.
And what do you get? What do you see?
So we see a lot of problems, especially around the shoulder area, which we get a lot. The other thing which we get is backs and knees. So that's a fairly big chunk of people. So these are the people who could have done better. That means slightly more sort of, stepping it up slowly rather than going on that bench.
So a gradual thing. Because you know what happens, doctor, there's a lot of dealing in the gym with gym instructors. There's competitiveness. There are friends who are giving you suggestions. So I don't know how scientifically developed a program is for a new person, for lack of a better word, do you feel like people should talk to the doctors before they start a program? This is completely out of the box. I don't think this is being done at all. But
so gym is a toxic environment. See, because you have all these, especially the worst is the women and men's gym together kind of a stuff. Everybody's trying to show off they can do better than the other person, and that weight thing which you keep on increasing it and you want to show it, you make that jump from that 5 kilo to that 25 kilo one. Because the other person was doing it, and you got into this machine and you say, "Ooh, he's done 25, and so maybe I'll give it a try," kind of stuff. So again, very toxic, but nonetheless, it's a great place to be in. So you're absolutely right. So the thing to do is warm up. I cannot tell you how difficult, we've seen it so many times. Even the most arthritic knee, the first two steps that you take are very painful. And the reason for that is everything is stiffened
Stiff
up.
from the
The
night.
more you actually get going, suddenly you realize I'm walking a bit easier. The joint has not improved. There's tissues around which have improved.
Warmed up.
So getting that warm up kind of a stuff, you need to have a routine, whether it's, jumping at the same ply, getting your knees to this, doing a jumping jack, maybe just running a bit, doing a few squats. But you need to get that to get going. Stretch yourself out completely. I love the idea of having a yoga kind of a stuff.
Yes,
Which
the stretching.
really stretches it out. I mean, it's one thing that yoga does very well. It may not make muscles for you, it may not make you lose your weight, but you stretch a lot, and that really makes sense. The gym instructor is a poor man. I really feel sorry for him. Everybody expects him to produce results quickly.
Yeah, he's supposed to be a magician.
Absolutely right. So, some people have a target of that weight, and, they've gone through the first month and say, I've only dropped 500 grams. Then they drop that poor guy, like a ton of bricks. Or, they're looking at the bicep and say, it still looks the same. There must be something wrong in that trainer.
Or I want
It's
to look
not.
like you. I want to look like the trainer.
And, you understand that, look, poor guy, I mean, he's trying to make you work. And, he has to then end up pushing you hard because you want to see a result quicker, because you're running out of patience. It really doesn't help you at all. He'll push it up. What's it to him? He'll go from that 10 kilo to that 15 kilo in no time at all. And all you've done is damage some muscles.
So there is some self-awareness that needs to come into play. And the warm-up is a very simple thing. If we incorporate that, we prevent a lot of injuries, yes?
There are lots of these things which one should actually understand and exercise. So the warm-up is great. The cool-down is also great. In between is the fact that things that you subscribed for. The things that you subscribed for now also need to be graduated very well. So you can't have sort of, doing the same thing again and again.
Yeah.
You need to sort of, change and say, look, I need to rest this out. You will always damage some muscles, some ligaments. Something to some extent will always happen.
Some muscle tear is supposed to be good for the body, actually.
True.
Mild
Absolutely.
muscle tear. Yeah.
Because that's what stimulates them to heal.
And
that's
then
what
grow.
stimulates the blood supply to increase. That's what actually makes you, unless you damage, it's going to be static.
But there's a difference between tear and injury and mild challenge and injury, right?
True. So you will just, it's just that little kind of a place, and you just tilt the balance over to that. So and you can't define the line and say this was enough, and one more set is going to be detrimental. So you need to work on that balance which you get. The other thing which people do is technique. That's where your gym instructor come in. He really needs to help you out with your technique. You see these people who say do a biceps curl, and they just drop their arms off straight.
And you're going to hurt
and you
yourself,
realize that, that's the thing which is going to actually cause the damage. If you just, stop the biceps curl, just before you get to full extension, don't take it all the way. Don't have to go with the idea of doing multiple repetitions on the same day. Small things, and your trainer will really help you. So having a good trainer worth their weight in gold, it really makes a difference with that.
So follow your trainer and expect change to be slow but consistent. That's important.
True, absolutely.
To prevent injury.
True.
Right. And when you're talking of injury, we're also talking and moving actually to chronic pain, because there are many conditions which may last for weeks, if not months, especially when the bones and the joints are concerned. Like I said, I have been under your treatment, and you have actually been very supportive. You've explained to me the difference between physical healing and psychological healing. And I have mentally felt stronger after, following your advice. So let's talk a little bit about chronic pain, doctor. What are the things that you see most commonly? I mean, I know of chronic back pain and neck pain, knee pain. These are the things one hears of. What do you see, and how do you recommend people deal with it?
Chronic pain is a very, very difficult field. In fact, if you look at, it's almost become a specialty, and specialty for some people. The problem with chronic pain are too many, rarely. So chronic pain, essentially what it does is it sensitizes the brain a bit too much. So if the brain, say, needed, let me just quantify it as a figure of 2 to stimulate the pain fibers. You actually, let me call it 5. A figure of 5.
Yeah.
You actually start stimulating the pain areas in the brain at a figure of 2. So it's called a sensitization of the brain. It starts responding at a much lower threshold to this.
Are you saying the pain is not real?
That's, in fact, unfortunately, chronic pains are actually, that is what physiology tells us.
So we have lost our acuity of understanding the pain?
So so you get something called a hyperalgesia. So the same things which may not have troubled you in the beginning are now troubling you because now you're in the chronic pain category.
You've had it for so long.
Absolutely. And part of it is got to do with the play of chemicals in your brain. So the brain has these good chemicals and the bad chemicals.
Right.
The problem with this chronic pain is the good chemicals, even when they get released, are absorbed quickly, and the bad chemicals are lingering around for too long. That is why if you look at, chronic pain in a country like UK, US and all, the pain clinic actually does not have one doctor sitting in there. So it has 5 people sitting in there. So you have an occupational therapist who will guide you on how you can lift your work. It has a psychologist who will actually tell you, how to manage pain, how to not let it influence you. You'll have a psychiatrist who will most likely end up putting you on some sort of an antidepressants and things like that, which will actually
And you
turn the
think that is needed?
balance. It's actually, you'll be very surprised how disabling chronic pain is.
No, it can be. Yes.
I can tell you, I must have close to, even in this year, have about 100 patients who've actually given up their job. They've given up their sports. They're sitting at home, watching television, thinking they're so riddled with pain that they cannot take a step out of their house. That is how big this problem is.
And you think that they could actually feel differently if it was
true. So remember, what we do is you end up looking and going back and saying, what was the root cause of the pain? And then you find, and then you do your investigation and say, actually, your MRI scan doesn't look so bad. How come you're in so much of pain?
And so could there be something else going on in life? Or you're saying the pain in itself took you to this level of...
Now this is going to open up a whole new chapter, because a lot of it is conditioning as well.
Yes.
So how you were as a child, what was the relationship between your siblings, your friends, your parents and everything actually influences your behavior, which is known. We knew that.
Yes.
How you respond to stress, this is like a response to a stress.
Yes.
So, some people will take stress very, very well and just get on with life. And I'm now occupying the chair. I'm wearing a hat of a psychiatrist out here. I started off wearing the hat.
Maybe this is what you're seeing.
Yeah. Sometimes all you need to do is actually, you'll be very surprised how they'll throw a file of prescriptions on your desk. And you see somewhere about 20 prescriptions from 20 different doctors. All of them have been giving them a painkiller with different brands and everything. And there is no mention of what is the diagnosis you're trying to treat.
So you're just treating the symptoms.
You're just treating the symptoms.
That's a whole
all you need to
thing.
do is actually, when I say all you need to do is, remember, the mind is so powerful. I can, you know that. I mean, we are having the, I don't know which magazine was this, Indian of the Year kind of stuff is they're trying. And there is this blind lady who's done Mount Everest without oxygen. When you think about it,
your mind to
what made it possible was the mind.
Yes.
So the mind is huge. My mind can actually make me go into so much of depression that I will not get out of my room. And that's what people need to understand. But sometimes you need to confront somebody and say, look, this is your MRI scan, this is your X-ray. With this, you are not expected to do that badly. Yes, you have a hyperalgesia, you're responding badly to this. You have a stress in your life. You have, your hormones, your enzymes are not helping you. But it doesn't matter. The essential thing is you need to fight this out. That's the only way it's going to work. You can be as sympathetic to them as you want to be and say, poor man, you should take a rest. But, the reality is, if these people would step it up and sort of, get through this. But I'm sorry, I'm really entering into a whole new field. But the thing that we know that helps in chronic pain is return to activity, return to your work environment, getting better relationships with your friends, your family, getting out with them, enjoying yourselves, taking up something or something. And also, that it looks very funny. The last point I've said, manage the problem.
Yes, I was going to ask you, what if the problem is genuine and the pain is real?
No,
maybe the degree of pain is varying.
Now the very clever evaluation of this is the doc who's treating. I'm not saying only orthopedic surgeons can manage this. All I'm saying is the doc who treats needs to take this into reality. It will not happen with a 2-minute consult.
Yes.
It will really happen.
You need time.
Yeah. Things like back and neck pain, my consult for a back neck pain is 15 to 20 minutes. Pretty much nobody does these kind of consults. Who's going to ask, Are you separated? Are you alone at home? Do you have a job?
As an orthopedic, you're not going to ask these
And
questions.
is your job at threat? Are you can you get along with your kids? Do your kids actually ever visit you? Kind of a stuff. You know that person who's sort of that social he's
Yeah.
actually managing despite the worst. But anyway, more important thing is evaluating and then separating out. You're the guy who can do better with surgery, physiotherapy or something, or you're the guy who needs much more social services, psychiatrist, a psychologist, somebody to help you, a home attendant or some change in lifestyle.
So it is a very holistic problem
It's
what
a
I'm
very
hearing.
holistic problem.
And it needs a holistic approach.
True.
It's not about giving medication only.
True. Absolutely right. So but remember, it's a tricky field because it's a lot of things to talk about.
But you believe pain management, its clinics, its consulting should be a separate field in itself? Do you believe?
Totally.
Should be there in India? And do we have
I'm telling
it in
you,
India?
if you're doing that, if you're trying to manage somebody's 1-year-old problem in 3 to 5 minutes, you cannot do justice.
Yes.
You need to sort of think more or send it to somebody who can actually think through it.
Thank you for this. This is very fascinating, actually. Okay, so while we are speaking of chronic pain, doctor, I want to speak about the relationship of doctors like you with the ancillary services. So when we speak of physiotherapists or we speak of acupuncture, or even if we speak of instructors like yoga and Pilates, how do you manage all these for your patients, and how are you realistically able to advise patients? I know you have one physiotherapist who's a part of your team, or maybe a few, but there might be others your patients go to who you're not connected to.
True. So, I mean, no treatment is in isolation. Zero doubt about that. Whether you seek your support of your family, whether you seek the support of your friends, your employer, or whatever, it's actually it's never easy. I mean, even putting a plaster on somebody's leg actually pushes that man into dependence. So you really need to, and we're very fortunate in this country that access to ancillary services, being a private healthcare, is very, very easy.
Yes.
You'll be very surprised. The cost of one physiotherapy visit in the United States is somewhere about $100. Try asking somebody who's been to Dubai and had an accident. I mean, this guy shows me bills which are about 8 to 10 lakhs for a simple ankle fracture, which in this country, including everything, is sort of 1.25 lakhs. So we 1/10 of what you're talking about.
We are fortunate in some ways.
Very fortunate. And we have some very dedicated physiotherapists, occupational therapists who are actually very, very helpful. They actually, my job is dead simple. I just need to see the patient once, twice, operate on them once, kind of stuff. The real actually heroes of this battle are these guys who actually manage this patient. Remember, nobody's a happy patient who's had an injury.
Yes.
Nobody's a happy patient who's in pain.
Yes.
So, managing these is a complex of, an evaluation of that patient. In their mind, they're evaluating that patient psychologically, they're physically helping him, they're emotionally supporting them, and they're getting them through. It's almost a hand-holding kind of a stuff.
So you think that's very important,
100%. The nursing staff, the physiotherapy staff, the occupational therapist, such an important asset to have if you want to have a successful practice.
And what do you think about standalone centers, about standalone physiotherapy centers who may not be working closely with doctors? You still feel that they are serving a purpose, and they are serving, even if patients go to them directly?
True. No doubt they have a role. And, the chronic pains and all is such an important thing which you mentioned. Can I just say, far too many times I've seen, you've had a fall and, you've had a twisted ankle kind of a stuff. And you go to this physiotherapist and you're telling you sort it out. Now, what does that poor guy do? He doesn't even have a diagnosis with him right now. He'll randomly ask for some x-rays, which gets done. It gets reported somewhere by somebody who wasn't very sure, why am I getting this x-ray done? He wasn't looking at that painful area because there is no slip which tells you, what am I looking for? Even if you were the best explorer in the world, you'd need a map.
Yes.
So you don't even have a map, and you've thrown all these 10 x-rays and find an injury kind of stuff. It's like, where's Wally kind of stuff. So I really think, the stepwise approach would be some sort of a medical intervention. I'm not trying to push people to say, oh, you come and visit me, I'm available. But it's just trying to say
collaborative.
A little collaborative effort.
Yes.
Standalones, I have some worry. I know they're very nice people.
Yeah.
I know they do a lot of job, but at least having a, like a map, a target kind of a stuff would be a good idea. And just some basic investigations would be a good idea.
So collaboration is needed. Right, doctors. Now, just before we close, I have maybe one or two last questions. What's the message that you want to send to people about better bone health, better musculoskeletal health, joint health? What do you want people today in India, urban India, modern India, with all the things that we are seeing? You've gone over a few of them, of course, but what do you
So
suggest?
the bone is your like the structure. It's like that, the pillars of the house kind of a stuff. Yes, you can put lots of sort of fancy paintings and paint the wall in lots of fancy ways kind of a stuff. If you have a weak foundation, nothing else
It's
going to
going to
work.
stand, yes.
And the body has to be seen as a unit. You cannot just say, well, the heart is separate, the bone is separate, the brain is separate kind of stuff. The unit has to be treated. So everything begins, if you ask me, with an attitude. Everything begins with almost like a desire to be on your feet and to be physically fit and performing till the last day of your life.
Absolutely.
So nothing actually comes close to the attitude that you need to have, and that dedication and devotion. It's like that car which needs a servicing. Even a mechanical thing needs a servicing.
Yeah.
Here we're talking about something which is working 365 into 24 and saying, why do I need to exercise? It's your servicing for the car. You cannot manage to run this. And when you walk, it's not just your bones and legs. It's actually your heart, your lungs, your digestive
Everything.
system, which works well. Your nerves work well. Your sensory organs get stimulated when you're outside the house.
Our body is smart, actually, if you allow it to be.
It's very, very smart. Generally, considering how little attention we pay to it, it does more service to us than pretty much anything. And I can tell you, be selfish. Be selfish about your own health. Nothing comes close to the body when it comes to looking after you till the last day of your life. Your wife will leave you, your husband will leave you, your kids will leave you. One thing that is there is your body.
Yes.
And you can only help somebody if your body is with you. The rest of the people also will actually work. You can do better if you get to look after your body.
True.
Be so selfish and so mean. It doesn't matter if you've not made that morning cup of tea for my sasurji and my sasuma. Everybody can make the cup of tea, provided if you get outside and actually walk outside and do your this thing, your mind is fresher, your body is fresher, you'll be a much better person. You can perform much better when you do that. So selfishness is all I can tell you, and center yourself on your body as much as you can.
Thank you, doctor. That was amazing. Thank you so much for your
Thank
insights.
you so much for having me. Thank
Thanks.
you.
Hope you like this show. Please do like and subscribe on YouTube, Apple, and Spotify. Please also follow us on Instagram at The Thoughtful Medic Podcast. Also, please share your feedback in the comment section of each of these. It'll really help us to create content which is based on your needs. Additionally, do share with your friends if you liked what you saw, and keep tuned in for future episodes of the Thoughtful Medic Podcast.